In East Jerusalem's Muqassid Hospital, a room is filled with Palestinian women from Gaza and their newborn babies. One of the mothers got pregnant with twins after 7 years of infertility. But when she developed complications late in the pregnancy, her Gazan doctor sent her here for emergency treatment just before the war started in October. Today, her twins, Abdullah and Odeh, are healthy 5-month-olds.
I'd like to go back to my home, and if it was safe to go back to northern Gaza, I would be the first one to go back. But it's not safe. My husband said it's better if I don't come back, even though he hasn't seen his children yet. And where can I get diapers and formula? I'm very scared.
These women and their babies, as well as 11 cancer patients in nearby Augusta Victoria Hospital, had already packed their suitcases because they were supposed to be returned to Gaza last week by Kogat, the Israeli army unit which deals with Palestinian civilians. But Physicians for Human Rights, along with 2 Israeli human rights organizations, appealed to the Israeli Supreme Court, which granted a 30-day stay while Kogat explains its reasons for transferring these patients. An Augusta Victoria cancer patient is concerned about his grandchildren in Gaza, but he's afraid it will be impossible to continue his treatment there.
Gaza is destroyed and it's very dangerous. There is no way to get treatment there. The Red Cross is taking patients out of Gaza and Israel wants to send us back. How is that possible?
Kogat says it is only sending back patients who are not in need of further medical care. But Physicians for Human Rights says Israel is putting them in danger by sending them to a war zone.
After chemotherapy and radiotherapy, the body is usually, even if you don't necessarily have another treatment for the next 2 months, for example, your body is still weak, your immune system is weak. And as you know, in Gaza, the whole healthcare system is under collapse. There's no functioning hospitals. There's no doctors are overwhelmed. They cannot treat. The cancer patients are being sent abroad.
Treatment for Palestinians at East Jerusalem and Israeli hospitals is entirely paid by the Palestinian Authority. The director of the Augusta Victoria Hospital, Dr. Fadia Trash, says that some of his patients have lost family members and homes during the fighting in Gaza. He hopes patients will be allowed to stay at the hospital until there is a ceasefire.
There is a catastrophe in Gaza. From all the points of view, there is no food, no electricity, no water, nowhere where they can live in a decent way. There will be refugees in Gaza, refugees with cancer in a place in war without enough supplies.
He says more than 750 cancer patients from Gaza had been scheduled to come for treatment in Israel since the war began. Most have gone to other Arab countries, but some are not getting treatment at all, and they don't know when or where they will find medical care. Linda Gradstein, VOA News, East Jerusalem.